Somewhere around 2040, 50% of Americans will trace their roots to the developing world. So the majority of Americans will be from the so-called minority group. We are not geared in this country to providing healthcare to people from this diversity of culture. Of course, there are many healthcare practitioners that can comfortably provide healthcare services to people from the developing world from different cultures, but they're not enough. So one of the key component parts of our Henry Schein Cares program, that's our social outreach program, is to work with healthcare workers, and in our case it's dentists, dental auxiliaries, and office-based healthcare practitioners in education in the area of cultural competency. So this has become a very, very important part of the Henry Schein Cares program, and we are very, very concerned that as America moves more and more towards the minorities being in the majority, that our healthcare system is not culturally competent enough to deal with these needs.
As we talk about health professionals and looking at it in the broader sense, one take-home message that I think I'd like to emphasize is that we are starting to make some inroads as it relates to talking to physicians and nurses and others of our and the non-oral health professions that are doing similar sorts of things. They're starting to embrace the need for oral health, knowledge of oral health as it relates to older adults. The conversation that we've had in regards to the oral systemic linkages, I think, has been a wonderful catalyst to bring that about. And I think from here forward, we need to look for other opportunities and mechanisms and linkages with these professional organizations, physicians, nurses, social workers, and the like, so that we might be able to collaboratively move forward in pushing the agenda of oral health.
At the very minimum, we talk about putting together a toolkit. We should be able to assemble and disseminate the best practices that are out there. We should be able to say to healthcare professionals, all healthcare professionals, that if they need information on developing a training for a physician or a nurse, if they're in a dental school and they've been charged with putting together courses or even a course or a lecture, they should not have to hunt for where this material is.
One of the things that we learned very early on was that you can turn students off if you don't prepare them properly. And it seemed very relevant with that you needed an adequate didactic base for the students and a comfort with clinical procedures before you sent them into an environment where they were dealing with at-risk older people. So until they were technically competent and not worrying about doing the technical thing, but then could interact with the patient and understand the issues, it was a stress level which they couldn't cope with to do that. And therefore, I think in the earlier years that they get experience with healthy older adults or relatively functional, independent older adults whose medical issues don't compromise their care. And when they're comfortable with that, then they can move on to the frail and functionally dependent.